In the wake of abrupt cuts to USAID funding, Vermont nonprofits, companies, and workers are left reeling. Plus, how the state is trying to prevent the spread of bird flu, and a look at drug treatment incentives and mental health services for prisoners in Governor Scott's public safety proposal. All that and more ahead on Vermont This Week.
From the Vermont Public Studio in Winooski, this is Vermont This Week. Made possible in part by the Lintelak Foundation and Milne Travel. Here's Moderator Mitch Wertlieb.
Thanks for being with us. I'm Mitch Wertlieb. It's Friday, February 14th. Happy Valentine's Day to all those who celebrate. And if you don't, it's also National Ferris Wheel Day, so you have an alternative. Joining us on the panel today, we have Ann Wallace Allen from 7 Days, Calvin Cutler from WCAX, and Lexi Krupp from Vermont Public. Thank you all so much for being here. I apologize for a little bit of levity at the top there, but we have some serious stuff to talk about. And that's why I wanted to get that out of the way first. And Ann, I want to start with this article that you wrote about in 7 Days, which is really fascinating. I mentioned cuts to USAID, that's the United States Agency for International Development at the top. These have been happening because President Trump has said that he feels it's wasteful spending to send money overseas to help with international development. But you have found in your article that these cuts are affecting Vermonters right here and people are losing jobs. What have you found?
Yeah, Mitch, this is a program that, as you said, it sends health care services, it sets up clinics, it does an enormous array of work overseas. It's an agency, a many decades old agency with 10,000 employees, but a lot of people in Vermont are actually affiliated with USAID programs, and many of them work full time, sometimes for contractors who get some funding from USAID, sometimes for contractors in other states that are completely supported by USAID. So you'll find somebody who works in the health sector who lives in Montpelier, works remotely, travels a little bit, and those people are all over the state. Vermont actually has a lot of returned Peace Corps volunteers, one of the highest number per capita, and a lot of Peace Corps volunteers go into this kind of work. So it wasn't that hard for me to find people who are working now and have been for a long time for USAID. Like, these are people who are established in their careers, and so they could tell me, yeah, I'm laying off. I've had to furlough all my employees. Some of them are in Vermont and some of them are elsewhere.
So these are a lot of nonprofits, but what other organizations might be involved here?
Yeah, it's nonprofits, and then it's also for-profit companies, because like one of the people I talked to works for a company that is getting funding from USAID to help set up broadband in places like Belarus and Southeast Asia where they don't have it. So it's a for-profit company that otherwise it wouldn't make sense for them to do this kind of work. And they have employees in Burlington, or a startup called ThinkMD, which came out of the University of Vermont. They are doing an array of programs aimed at helping provide health care through AI and through training when there's no doctor on hand. You're in a very small village somewhere, but there are healthcare workers. And so they had a $1.5 million grant from USAID to help them do a pilot project in, I think, Nigeria. And their funding is imperiled for the same reason. They don't even know if they're going to be able to keep doing this. It seems kind of unlikely.
So these are people who maybe have already lost their jobs, and are there further job cuts that could come from this, do you think?
And I should also add, there's two companies that in Vermont, Residence and Tetra Tech, two different companies that actually do this full-time USAID work. So many of the people I talked to had actually lost their jobs. I talked to one woman who she was furloughed, her husband was furloughed, he had surgery coming up next month, they're losing their health insurance. And, for many of these people, they're living in Jericho, or they're living in the Lake Champlain Islands, or they're living somewhere where they can afford to live and work remotely. And if they lose their job, it's kind of a specialized area, it's a niche area, especially if you've been doing it for a long time.
I will say also, the broader sort of political context here in Washington too, there have been some carve-outs for some of these programs in other states because, defunding USAID across the board, that's millions and millions of dollars, lots and lots of jobs. but there's been certain programs that it's interesting that there's individuals that are Republicans in Congress that are aligned with President Trump, and that they said, well, we can keep this program or keep this program, but we'll move it into the Department of Homeland Security or move it to this place. So it really, USAID as a program is getting the axe, but some components of it, depending on where you are sitting in Congress, those jobs might stay. But
Kelvin, I'm so glad you brought that up, because you actually anticipated my question. And I was going to ask you about this because, again, you were concentrating on what's happening in Vermont and the job losses here. But I was wondering, Vermont is considered a blue state. USAID, as Calvin was just saying, there are other states where this is happening. But you're saying there's a political component to this as well, where perhaps there's protections for people working in these more red states?
Yeah, well, that's one of the things that Senator Peter Welch had said when there were these broad cuts from DOGE and there was a broad restructuring of the government. Peter Welch had said that when programs are cut in red states, strongholds of President Trump, that maybe he might get some pushback among Republicans in Congress. But what we're seeing is that, at least with some of these USAID programs, in other states, there have been carve-outs, that there's been negotiations, and Republicans have been able to sort of work behind the scenes. So, I'm sure there still will be. It's tough to paint with a broad brush here. It really does get down to the nitty-gritty of each individual program and what state it's in. But the political factors, the political influence and sort of what programs stay and which ones get cut, there is a political element to that as well in Washington.
And briefly, yeah, go ahead, please.
And I also wanted to add that it's not just people who are individually working for these organizations in other states, but there's also farmers, even in Vermont, who grow food for USAID programs. That's what they've been doing. That is their primary means of support. And if that goes away, that's going to be a different kind of pressure, too, for the Republicans.
We're going to have to see that, and we'll follow your reporting on that, of course, because it sounds like this could have more effects down the line. Calvin, also wanted to talk about Vermont had planned some EV chargers to have in the state. This was going to be put on, but it's been put on pause now because President Trump has suspended that program. What's the effect there? Yeah,
right. I mean, we've had millions and millions of dollars from the American Rescue Plan, the CARES Act, the Inflation Reduction Act, the Infrastructure Act for EV charging infrastructure across the state. There's been lots of contractors. It's part of really the state's vision, or the nation's vision, one might say, to drastically restructure and how we heat our homes, how we get around, the electric revolution, so to speak. But one of the programs that's been on the chopping block in Washington has also been subsidies for electric vehicle chargers. Here in Vermont, the latest tranche of funding, there was about $9 or so million, maybe a little more than $9 million that is being put on pause. So it has an immediate impact, of course, with building out charging infrastructure, in a rural state like Vermont. That has been challenging for EV owners, to get from point A to point B and have that reliable grid. But also, this could have broader implications on state policy as well. Coming up, we've got clean car and clean truck emissions, where a certain number of EVs or cars rolling off car dealerships lots have to be EVs. This could have an effect sort of on how all of that operates. Plus, we have our legally mandated obligations under the Global Warming Solutions Act to reduce our carbon pollution. The highest share of that comes from cars and how we as Vermonters get around from point A to point B. So I think this certainly could have some broader implications on where Vermont's climate policy goes as a state. It
could affect tourism too, right? I mean, you want people to come to the state. We already know that Vermont has a large chunk of its funding now coming from tourism, and people want to come if they have EVs. They want to be able to charge their cars.
I was up in Berlin, and I was talking with a gentleman at the gas pumps, and he said that during the eclipse, there were tons of cars from Connecticut, Massachusetts, et cetera, that were parked there at the rest stop in Berlin, waiting to get in line for the EV charger so they could get back to Massachusetts. Now, we're not going to have, of course, eclipse, sadly, every year, like foliage season. But, to that point about how other states are going, what direction the national EV marketplace and the national automotive industry is heading, some would say having those charging stations would be a benefit to Vermont. So I guess it's one of those things. We'll just have to wait and see, but it definitely will have an impact for sure.
I want to move on to something that's happening at the University of Vermont, and Lexi and Ann, you've both been reporting on this. UVM earned a designation as a top-tier research institution recently. Lexi, what can you tell us about that?
Yeah, this is this coveted R1 status, which stands for Research 1, and it's basically an indication that the university spends a certain amount of money on research. And so I talked to Professor Kirk Dombrowski there, and he said this is the #1 question we get at job fairs, talking to potential faculty and students, is, are you an R1 university? So it's really cool for them to sort of earn this and be able to attract students, faculty.
That's the good news aspect of it.
Yeah, yes.
but are there concerns now about that research funding being at risk at all?
Well, so more impacts of changes at the federal level. There has been this proposal to change how the NIH, the National Institute of Health, awards its grants and cap how much indirect spending universities can get. And so those potential changes definitely could have a big impact on the University of Vermont, down, Dartmouth Hitchcock Medical Center. They're potentially, millions of dollars that these universities could lose, and it would definitely limit the amount of science that happens and impact. There's hundreds of people's jobs are funded through that federal money. Not entirely, but it helps employ a lot of people in the region. So if that funding were to go away, or parts of it were to be sort of had these added constraints, it would impact the University of Vermont, down at Dartmouth, a lot of these research institutions.
It's amazing how much waiting people are doing it with the anticipation, just the uncertainty, I guess, is really starting to come home here. And I know that there are healthcare costs could be affected at UVM too by this. There could be possible budget cuts from all this.
So UVM has positioned itself as a research university in part, and hired Kirk Dombrowski, who's the vice president of research, in order to build up its research funding. He has worked to get the National Science Foundation on board with some really big grants and do a partnership with Global Foundries, and their research funding has gone from $220 million to $260 or I think $70 million over the last few years, because he's been trying to supplement tuition, because our demographics are resulting in tuition not being as strong as it could be anymore, and they've got to look for other ways to keep a fairly big university in a state with a diminishing number of high school graduates. So the impact of a hit to grant funding at UVM it's hundreds of millions of dollars now for UVM. I will say the R1 designation, while it's a great thing that they got it and they've been working toward it. Vermont is the last state to have a university with R1. All the other New England states, not the last state in the country, but the other New England states all have a university with an R1 designation. So it's more that Vermont is catching up with some of its peers. Like 3 of the UMass schools have it. But you're right, the budget, UVM is having budget problems. In fact, they did come out, and their vice president of finance did come out and say that he had asked the heads of their administrative units and their academic units to just look around for savings, because they might be asked to make some cuts this spring when they see what their revenues are going to be for next year. And the problem, as it is with so many of the other places that we work with and see and even work for, is health insurance costs. Yeah. They went up 17% last year. And Richard Cate, the vice president of finance, told me that this year he thinks they're going to go up 19%. It's a huge amount. It's too much for them to absorb without doing cuts.
That could be very significant. All right, we have to talk about what Vermont is doing to prevent the spread of bird flu. Lexi Krupp, you have been talking with Health Commissioner Dr. Mark Levine about this. I know you've been digging into a lot of this research. First, scare the heck out of me about bird flu, and then tell me why I shouldn't be all that scared, actually.
Okay, I'm going to reverse that.
Okay.
And I'm going to say, first, the risk to the general population of bird flu is low. This is not a virus that we have any evidence that spreads between people. So it's not something that should be keeping you up at night. I think at this point, and we've heard about this bird flu for several years now. It's been really devastating among wild birds, among poultry, a lot of marine mammals, cats, all sorts of different species have been impacted by this. I think about a year ago, this virus showed up in cattle in Texas, and now it's been detected in cattle all over the country and dairy farms. And there's this, we've seen the virus move from dairy animals to workers, to people. So again, not that human-to-human transmission, but there is the cow-to-person transmission, and the state is being pretty proactive about trying to test and get ahead of this thing, just to know what's happening. Yeah.
That's good. Now the scary part.
Oh, okay. So,
and again, I'm not trying to alarm people, but
so the testing programs that are happening, they're testing milk from dairy farms, and they're also testing hospitalized flu patients to say, what type of virus do you have? Is it just the human flu, or is there any avian flu floating around in there? And I guess the reason for that is Dr. Levine was speaking with lawmakers earlier this week and sort of painted the scenario of what they're really concerned about. What he's really concerned about is someone who has the flu, the human flu, picking up avian flu, H5N1, and those two viruses mutating and exchanging genetic information such that the avian flu would then pick up a mutation where it could more easily transmit between people. Right now, it doesn't really like the cells that line our airways, epithelial cells, but it could, the concern is that it would mutate, pick up a mutation where it could then spread between people. But that has not happened, and it may never happen. But it's definitely possible, and that that is scary. And we've seen animals, pets get sick from the bird flu. Several cats across the country have died. There have been now almost 70 people in the U.S. who've had bird flu, one fatality.
One death from that, New Hampshire, I think, right?
I think Louisiana.
Okay.
Yeah, but it's a concern. It's a potential. That it is not hopefully scary yet.
Okay.
Yeah.
No, I appreciate you couching that in those terms, because we don't want to alarm people. But again, the good news here, I think, is that the state is being proactive in going to farms, in talking to farmers, and getting out in front of this as much as they can.
Yeah, I think the health department ran a number of vaccine clinics at farms, I think around 51 in the fall. And something that Dr. Levine was saying is a really good way to prevent this is to have fewer people being sick with the flu. And we have a lot of flu cases right now.
Yes.
And our vaccination rates are not that great. In the last 3 years, there was an average of I think 40% of Vermonters had a flu vaccine. This year it's lower. It's closer to 34%. So Dr. Levine was saying, one thing we could really do is increase that vaccination rate to prevent, fewer people from having the flu, and that may not happen. Yeah.
Calvin Cutler, I know it's been oddly sleepy at the State House a little bit. It's a bit strange this time of year, but You have been reporting on the governor's new public safety proposal and a couple of components there dealing with drug treatment incentives and mental health services for prisoners. What can you tell us?
Yeah, it's interesting. We talk about public health from like the virus and the bird flu lens. There's sort of a public health element to public safety and accountability. A lot of the talk from the governor's plan and discussion has been around bail reform and raise the age and sort of accountability measures. But earlier this week, Governor Scott and his team sort of outlined a few of their priorities, which deal with mental health and drug abuse and addiction, which also really have a huge role in the public safety challenges. And there's two programs that they're looking to sort of jumpstart. One of them being, I believe it was a pilot program in Chittenden County from State's Attorney Sarah George was working on this a few years ago, which is working with individuals who are using stimulants like cocaine and methamphetamines, and if they can stay clean and get into recovery, there will be cash and financial incentives. Research has actually shown that it's a treatment model that is showing some promise. Wow. So the state is looking to expand that. And also the other one is sort of expanding what's known as a protective status. So for people that are publicly intoxicated, which is not illegal, but people that are belligerent and could be a harm to themselves or to others, the state would like to sort of bring back or to expand the protective status where people would be able to, authorities would be able to take this person, I don't want to say into custody because it's not like they're being arrested, they're not being charged, but they would be brought to correctional facilities where they'd be able to detox. And while they're at the correctional facility, there would be mental health experts there that could try to connect them with other resources. So they're trying to be more strategic with how some of these state dollars are spent.
And so they'd be bringing in extra staff to the correctional center, so they weren't just being put in jail.
Exactly. Yeah, there would be specialists in the facilities, and the idea is that these people would be trained in de-escalation, mental health, et cetera. Because as the governor and Commissioner Jen Morrison have pointed out, I mean, this is a very relatively small population of individuals that we're talking about. It's a lot of them the same repeat offenders, committing crimes, sometimes non-violent acts, sometimes violent, and it's very much on police's radar. So trying to connect these people with those resources in a state where our laws around involuntary commitment, involuntary medication, those are we have some of the strictest laws around that. I think these are two more strategies to try to connect people with treatment and mental health.
I appreciate that update very much. Want to mention quickly that the state Supreme Court has dismissed a lawsuit brought by senators over the education secretary, the appointment of Zoe Saunders. This was, this was a real sticking point for Democrats before the elections happened. Now the state Supreme Court saying basically this is a moot point, right?
Yeah, it's interesting. There's a lot that went into this. Of course, there was the discussion around what does the appointment of Zoe Saunders mean for public education. That was sort of the concern, but also it really kind of boiled down to a discussion or a debate about the separation of constitutional powers, and the governor can appoint, but the Senate has to confirm those appointments. So I think it is significant that the Supreme Court basically just said, we are not going to touch this one. We're going to let this lie. So it certainly does close a chapter in that regard with the Zoe Saunders debate. I know she technically still does need to be confirmed this session by Senate lawmakers, which will happen likely near the end. And but Senator Phil Baruth had said that given the challenges we're seeing in terms of education funding reform and all that's on state lawmakers' plate this year, that's pretty low on the priority list.
I want to mention something, Lexi, that you had been reporting on, I believe, for Brave Little State about, it's fascinating how Vermont got so many town forests. Without giving away the whole episode, give us a sort of a thumbnail so that people can know what to look for as they go find that story.
Yeah, well, we've been talking a lot about our democracy, and I think something that's sort of inspiring about town forests is that it's like democracy in the woods, in a very local level. So these are lands owned by towns or other forms of public government. It could be a school district, could be a fire district. Most towns have them, many have more than one. You've probably seen one or been in one and not even thought about it. But these lands have have had so many different uses. Like in the 80s, a bunch of town forests were used when there was an energy crisis for firewood. You know, county foresters would go out and mark 3-cord lots, and people would come with their wheelbarrows and their saws and, you know, get firewood from there. There's a lot of town forests that have mountain biking trails, hiking trails, or, you know, areas set aside for wildlife and habitat conservation. So they're a really, really cool look at ways different towns want to relate to the land. You know, there's flood mitigation projects on some of them, all different uses, and they all have pretty interesting histories that were surprising and at times delightful. And I also learned a lot about Vermont, like the history of Vermont. So that's my tease.
Fantastic.
Yeah.
So show some love for Brave Little State and
Yeah.
the Old Forest episode. Check that out. Before we go, I have to mention, if they get in, perhaps raise a martini of bathtub gin. I did that one for you, Calvin. I'm talking about Fish, Vermont's own band, born here at the University of Vermont in the early 80s, nominated for the Rock and Roll Hall of Fame. You think they're going to get in?
You know, I think so. There's a lot of energy around it. I mean, it's a huge deal, long time coming. I mean, some would say that they've already had an impact on this institution. New Year's Eve, 1994, Fish flew among the crowd in a hot dog, which is the first thing that you see when you walk into the Rock and Roll Hall of Fame. So big deal for a big Vermont band.
I certainly hope they get in. You've seen them a bunch of times, I'm guessing, right?
12.
12 times. Okay, I saw them a couple of times. They're a fantastic band, born right here in Vermont, so we're going to hope they get into the Rock and Roll Hall of Fame. That's all the time we have for today. Thank you to our panel, Ann Wallace Allen from 7 Days, Calvin Cutler from WCAX, and Lexi Krupp from Vermont Public. Thanks everyone so much for being here. I'm Mitch Wertlieb, and I hope you'll join us again next week for Vermont This Week.